As this outbreak grows globally and the number of cases in the U.S. rises, many are wondering what the government will do and what they can do in order to prevent the spread. Joining us with more on that is Dr. Fygul Ding, an epidemiologist at Harvard, and former Homeland Security advisor and ABC News contributor Tom Bossert. Thank you, gentlemen, for joining us. Dr. Fygul Ding, I'd like to start with you. How does the lack of testing kits in states like California and elsewhere affect the U.S.'s ability to actually measure the virus's spread?
Yeah, without testing, we are literally driving blind, as if we have no headlights at night, because testing is the cornerstone of stopping an outbreak. Without testing, you can't isolate where those patients came from, trace who they were exposed to, and find out all the clues in the community, which right now in California they have to do in 2 counties in the dark, pitch black, and delayed by 1 to 2 weeks. So testing is a cornerstone to isolating this epidemic. And without testing, you can't have an epidemic. This is why it is so critical that we have testing nationwide.
And Tom, in your experience as someone who's worked as a global health security, how prepared are we at the federal level to combat this?
Yeah, so there's a couple of answers to that, but we're at the second inflection point. So the first inflection point has to do with the quarantining that we've seen take place already in an attempt to contain this. We're past containment. This will spread. It will spread in the United States. The degree and the time of that spread is unknown. We don't want to create any panic. But the point that the doctor just made is important, because right now we don't have diagnostic testing, and the CDC is still waiting for definitive diagnostic testing. We're up against now 2 clocks, and this answers your question about whether state, local governments and health authorities are ready for this. If we get to, scientists tell us this, if we get to 1% spread in the population, it's too late for these non-pharmaceutical interventions to really work. And so that's the first timeline that we're running up against. The second one is this race to get these diagnostic tests deployed to hospitals, to have these tests conducted on actual patients, and to get those reliable numbers back. If those 2 timelines start to run into one another, where we're approaching 1% and we have evidence to suspect that we're getting there, because again, it'll be probably 14, 20 days in front of us actually getting there, we're going to have to start making hard decisions and shifting away from this insistence on diagnostic testing results and into clinical ones. They're less reliable, but if someone, let's say a patient, shows up demonstrating the symptoms of an upper respiratory problem like the flu, and perhaps test negative for the flu, you're going to have to start presumptively thinking that they are potential COVID patients. When you do that, it's less reliable, but it gives you the information necessary to make good decisions, maybe not perfect ones. As that happens, the government's going to have to start making staggered decisions, not centralized ones out of the federal government, but state and local ones and community-based ones. And that's the race that we're going to have to pay attention to for the next week.
And Dr. Fygul Ding, this is a question that's been asked and answered, but I think people are still interested and eager to know. They're wearing face masks. They're canceling trips because of COVID-19. What should we actually be doing to protect ourselves and to prevent the spread?
Well, right now, I think until we have a vaccine or antiviral drugs that were known to work, which vaccine will take a year and antiviral drugs will take 6 to 9 months to prove that it works, we have to focus on other countermeasures and to delay and slow the progression. Again, this is inevitable. So besides the obvious things like hand washing, we need to practice social distancing. Social distancing means a wide range of things like avoiding concerts and rallies, maybe even political rallies. We might have to think about that in the near future. And schools, we might have a lot of tough decisions around that. But in addition, I think handshakes, we might have to pass on handshakes. It might have to go to fist bumps and other kinds of ways of greeting people. And again, these face masks, they don't really protect you all the time, because surgical face masks have no protection, but it actually does protect you from transmitting your own saliva and spit around, which in an epidemic potentially would be critical. But again, getting testing is also critical if we can get it free for every single American. Because if people are hesitating on getting testing because it's going to cost them too much money, they'll cost this epidemic potentially huge amounts of time. And this is why testing, Korea can do like 80,000 tests in 1 week. We need to ramp up our tests more than just 500. We need to ramp up to a scale that America has never seen before.
And Tom, the U.S. is greatly dependent on China, of course, when it comes to pharmaceuticals. At what point would the government sound the alarm to Americans about a possible shortage of medications?
Yeah, there's two kind of alarm bells here. I think the doctor just summed up the first one. This is really important for the viewers to understand. Now that we're at this second inflection point where we're trying to implement these non-pharmaceutical interventions, the purpose of that isn't to prevent each individual viewer from getting sick. The purpose is to kind of shift to the right and flatten this spread curve. And if you could imagine a very sharp spike on a chart, that presents a lot of strain on our healthcare system. If we can slow the spread of this so that the healthcare system is not overwhelmed, we don't have to ration pharmaceuticals and ration healthcare. Now, separately and unrelated to the availability of pharmaceuticals, we are 3 years past the wake-up call here on diversifying our supply chains. Economic advisors dating back, Gary Cohn spoke about this regularly. The United States has about 60% of its pharmaceuticals coming from China. Western Europe is more reliant with closer to 80% of their pharmaceuticals coming from China. We're going to need to diversify that, or it becomes a non-military national security matter moving forward.
And so to go back to Dr. Fygul Ding's point, I guess a lot of people were going to see more just hand waves, hello and goodbye, and perhaps elbow bumps or something of that sort. But with that, gentlemen, thank you very much both for your time.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.